Super. It's great to see everybody joining us today. I'm really excited about this topic today, both with medical complexity and with our patients in general. I think health literacy is so crucial, so excited to learn today. I just had a few house cleaning things before we get rolling. Just a reminder, the session's being recorded, so we can share it with you afterwards. Your microphones have been muted, but you are a small and mighty group today, so we'd love it if you unmute and ask your questions, as well as typing your questions into the chat. If you're able to, we love it when you're able to keep your camera on. It really helps us with developing our community of learning, but it's also just fine to eat lunch as you're joining us too. Your completion certificates will be emailed. With that in mind, it looks like many of you have already renamed yourself using the 3 dots on your Zoom screen. That helps us know your name so we can complete their certificates. So with no further ado, let's get started. I know our team's known to many of you who are returning, but I'm glad to have Dr. Emily Goodwin presenting today. She's a pediatrician at Children's Mercy Hospitals, as well as Dr. Ryan Smith, also a pediatrician at the University of Kansas Health System, as well as Dr. Dana Bakula, a pediatric psychology fellow at Children's Mercy. So thanks so much.
Thanks, Evelyn. So for today's session, we will, after introductions, do some brief disclosures, and then I will give a didactic. We'll have a little bit of time for questions, and then we'll move on to a case presentation, which we've invited a guest speaker for, and then active group discussion. And as Evelyn said, it's a small and mighty group, so please feel free to put questions in the chat as you have them. We'll also have some time at the end. Next slide, please. So we have no relevant financial relationships with the manufacturer or any commercial products or provider of commercial services discussed in the CME activity, and we do not intend to discuss an unapproved or investigative use of a commercial product or device in our presentation. Next slide. The information and recommendations involving clinical medicine are based on evidence currently accepted within the profession. Next slide. As Evelyn mentioned, the slides and recording will be sent after the session, as well as certificates of attendance, which will be sent when the series concludes. And if you have any questions that don't get answered during the session, you can send them to telehealthrocks@kumc.edu, and we'll be sure to answer those for you. Next slide. So today's session, our theme throughout this ECHO series for All Under One Roof, caring for children with medical complexity, has been a theme of social determinants of health. And today we're going to focus on health literacy. So by the end of today's session, I hope that you'll be able to define health literacy, describe how health literacy is a crucial social determinant of health for children with medical complexity across all settings, and learn health literacy informed strategies to apply with parents and individuals or students. Next slide. Okay, so somebody mentioned ice cream earlier. We're going to have an interactive activity right now. There'll be some Zoom polling questions that come up using this nutrition label, which is actually used in a health literacy assessment called the newest vital sign. So pretend that this is a nutrition label for a container of ice cream. And I'm going to ask a series of 6 questions, and at the end, we'll go over the answers. So next slide, and then we can pull up the first question, which is, if you eat the entire container, how many calories will you eat?
And I have launched the poll, so it should pop up on your screen. If you are not seeing that on there, just go ahead and write your answers down and keep track of them, and we'll give the answers at the end.
Thanks, Christy. I'm going to want ice cream at the end of this. Okay, I'll give a few more seconds. Looks like most of you have answered. A few more people still working. Okay, let's go ahead to the next question. If you were allowed to eat 60 grams of carbohydrates as a snack, how much ice cream can you have? Okay, let's go ahead to the next question. Your doctor advises to reduce saturated fat. You usually have 42 grams of saturated fat, including 1 serving of ice cream. If you stop eating ice cream, how many grams of saturated fat would you consume each day? Making everybody really work during their lunch break today. Okay, let's go on to question 4. If people need a little bit more time, we can certainly give you a little bit more though. Okay. So question 4 should be popping up soon. If you usually eat 2,500 calories in a day, what percentage of your daily value of calories will you be eating if you eat 1 serving? Okay. Let's go on to question number 5. Pretend that you are allergic to the following substances: penicillin, peanuts, latex gloves, and bee stings. Is it safe for you to eat this ice cream? Okay, and the last question really kind of piggybacks off of that one. Why or why not is it safe to eat the ice cream? Okay, I think most people have answered. So now we can kind of step through the answers. And I think that as we go through one by one, it will actually show you what your previous answer was. So I'm going to give you guys the answers, and for each correct answer, go ahead and give yourself 1 point. Okay, so for number 1, the question was, if you eat the entire container, how many calories will you eat? The answer was 1,000. And I didn't answer the poll, so hopefully that's help. Is that popping up for everybody that they can see what they answered? Seeing some yeses and some nos. If it's not popping up for you and if you can't remember, just do your best. It's you don't have to turn this in for a grade or anything. Okay. The second question was, if you are allowed to eat 60 grams of carbohydrates as a snack, how much ice cream can you have? So the answer was 1 cup or half the container. Since the serving size was half a cup. All right, for question number 3, was that your doctor advises to reduce saturated fat. You usually have 42 grams, including 1 serving of the ice cream. If you stop eating the ice cream, how many grams of saturated fat would you consume each day? And the answer was 33 grams, just subtracting that 9 grams of saturated fat from the total you were having. Okay. The fourth question was, if you usually eat 2,500 calories, what percentage of your calories will you be eating if you have 1 serving of this ice cream? And since it's 250 calories per serving, that would be 10%. So the answer is 10%. And then finally, the 5th question was asking if it's safe to eat this ice cream. And the follow-up to that is, why or why not? So the answer is no, it is not safe because it contains peanuts. So again, give yourself 1 point for each correct answer. And this is an actual health literacy test. It is suggested to be used when taking vital signs, and that's why it's titled the newest vital sign. And a score of 0 to 1 for all 6 questions suggests a high likelihood of very limited health literacy. A score of 2 or 3 is a possibility of limited literacy, and a score of 4 to 6 almost always indicates adequate health literacy. So we did this exercise just to kind of get everybody engaged and think about all the different components that go into health literacy. I'll define it here in a little bit, and we'll talk about why we don't actually in practice in medicine recommend, only for research purposes, but we don't recommend in practice screening for health literacy because everyone benefits from clear communication. And we recommend a, quote, universal precaution approach to use clear. Next slide. And I have one more question for y'all. Uh-oh, it says my internet is unstable. Can everybody still hear me? Yeah, okay.
We can hear you. Did freeze for a second earlier, but I will let you know if that continues to happen.
Okay, thank you. So true or false? Health literacy, according to Healthy People 2030, is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services to make appropriate health decisions. And this will be our last polling question. So thank you everybody for participating. So almost everybody is marking it as true. It's a little bit of a trick question because this used to be the Healthy People definition for health literacy in both 2010 and 2020, but it has changed. So Healthy People 2030 actually fairly recently came out. And the definition now has changed to account for both personal and organizational health literacy. So next slide. Personal health literacy is defined as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves or others. This definition really emphasizes people's ability to use the health information rather than just understand it. Next slide. And then the organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So this newer definition focuses on well-informed rather than appropriate, and really incorporates that public health perspective and acknowledging that organizations also have a responsibility to address health literacy. It's not just an individual trait. It's really influenced by the complexity of the healthcare system and the world in which we live. Okay, next slide. So health is more than healthcare. And again, social determinants of health has been our theme throughout this ECHO series this year. And socioeconomic factors, physical environment, health behaviors, and healthcare are all components that influence outcomes in health. And next slide. Literacy, language, and health literacy all play into that. And it's really a big spectrum, economic factors where someone lives, their physical environment, their education and their access to that, as well as access to food, community, and social resources, and just the complexity of the healthcare system can all impact healthcare outcomes. So for health literacy in particular, you can go to the next slide. 77 million of adults, or 35% of the US population, actually have low health literacy. So they would have trouble doing that exercise we all just did with the nutrition label. And that includes 28% of parents. So only 8% of adults are actually categorized as having the highest level of health numeracy skills, so the ability to use numbers to make health decisions. As you could tell from going through those questions, there are a lot of different components to be able to understand that nutrition label and make decisions for one's health. So health literacy affects knowledge, but also behavior and outcomes related to pediatric preventative care for acute and chronic conditions. So next slide. This is kind of another way of depicting that from a Pediatrics Review article. And you can really see that education, language, culture, access to resources, age, those are definitely factors that affect a personal health literacy skills. And certain populations are actually at higher risk of having lower health literacy, and that's probably related to all of the different social determinants of health. So certain racial and ethnic minorities, or people with less than a high school degree, low income, and then non-native speakers of English, or people with chronic health conditions are at higher risk for having low health literacy. Next slide. So particularly when it comes to children with medical complexity. So again, these are children who have multiple chronic conditions, often rely on technology such as a G-tube, a tracheostomy, have lots of medical equipment, high utilization, lots of frequent specialty visits, ER visits, hospital stays, lots of medications, some often multiple caregivers. It stands to reason that this population of children is at higher risk for complications related to health literacy and not understanding care plans. Just even thinking about the list of things that are involved in their health. So school forms, medication instructions, understanding complicated nutrition instructions. During the pandemic, having to navigate virtual learning, just even homework assignments, advocating for resources or understanding an IEP or 504 plan, understanding COVID-19 protocols and how an individual's risk may be affected by the ever-changing information. Now we have tons of patient portals through electronic medical records and being able to navigate that. There's even remote patient monitoring. And again, multiple caregivers that may care for this population of children. So you can see that there's probably a lot of risk for confusion or misunderstanding or even errors related to the complexity of their care. Next slide. Additionally, we know that health literacy worsens in situations of stress. I know if I have to take my child to the emergency room in the middle of the night, I am probably not going to be at my highest level of understanding, right? And caregivers for children with medical complexity are under high levels of stress and often experience very high levels of stress. So again, it's important that we remember to always use clear communication when speaking with anybody, no matter what their level of personal health literacy is. Next slide. So in doing the newest vital sign, you could see literacy is more than just reading, right? Health literacy is more than just reading or literacy skills, but it includes understanding numbers or numeracy, but also speaking, listening, and communication skills, writing skills, accessing information, and appraising information. And in general, next slide. There are some tools you can use that are health literacy informed and evidence-based to help individuals have clear understanding and communication. Just as someone's health literacy can worsen in times of stress, people can actually improve their skills even in adulthood. And so here's some strategies, and I'll go through one by one that you may consider using as tools in your toolbox. It's going to include limiting information and using explicit action-oriented instruction, plain verbal and written language, using demonstration and multimedia tools. Next slide. So for plain language, kind of think of chunking information and then checking it, breaking it down into bite-sized pieces, checking for understanding and moving on. For me as a pediatrician, I always have to be really mindful. I went to medical school and learned all these fancy medical words, but when I talk to people, we really should be avoiding medical jargon. And using action-oriented terms is really key. And then of course, consider what is the individual's preferred language. So if English is not their preferred language, using an interpreter and being culturally competent. An example of a clear action-oriented instruction would, instead of take this medicine, be swallow this medicine. Next slide. Teach back or show back is a way of demonstrating. So if it's a new skill, you can have someone, you can demonstrate it and then ask them to show it to you. A lot of times as a provider, I will give instructions and then I'll say, I just shared a whole lot of information. I want to make sure I'm doing a good job explaining it. Could you tell me back in your own words what what we're supposed to do with this medicine, or what the plan is before next visit, et cetera. So again, it's asking and explaining in their own words, but in a caring way and not a patronizing way. And it gives opportunity to check for understanding, and if needed, clarify in a shame-free environment. And in the chat, there is a teach back training that if any of you are interested in boosting your skills and using teach back, there's a free training for that. Next slide. So written information should complement verbal instructions, and again, be in plain language, very action oriented. And ideally, it should be written in short sentences that aim for the 6th grade reading level or lower. If you're writing anything, there's a tool in Microsoft Word that you can often see what the reading level is. And there's also some other free tools that I'll share in the resources. Next slide. So pictures and videos can really enhance any sort of education that's being given. And many of you are educators and probably are very skilled in this area. And again, it should really emphasize the same information that's in the written, but it can complement it. Next slide. Finally, digital health literacy. So as there are more and more online tools, there also comes a lot of misinformation that is out there too. So digital health literacy includes the ability to seek, find, and understand and appraise health information from electronic resources and apply that knowledge to address or solve a health problem. So that could be accessing a portal or electronic record, knowing when to use that to communicate with a care team versus calling, and being able to discern reliable health information. So this Health on the Net certification is one way you can encourage people to make sure they're looking at a reliable source of health information. But it also brings up accessibility, and some websites are more accessible than others. And it adds a whole other layer of social complexity to accessing this information, along with internet access and a number of other disparities that have been seen across this pandemic, especially. Next slide. So the National Health Education Standards have been developed, and they serve as a reference for school administrators, teachers, and others addressing health literacy or developing curricula. In general, it's been found that there's just inconsistent health curricula across grades K through 12. And the CDC is looking at different tools for evaluating and implementing those. There are 8 standards that students are expected to know to promote their personal, family, and community health, including how to evaluate credible information online, media and information literacy, but also professional development to educators and those in the health sector, and embedding health-related tasks into lessons. Next slide. And that's why I think that topic is so key to this group of individuals today too, that are joining us, as many of us are in health and education settings. And there are lots of challenges to implementing consistent health education in schools, and lots of policy collaboration that is potential to help enhance the organizational health literacy that we provide, so that we're giving clear communication. And the CDC has some tools that you can use to free curriculum, as well as tools to assess curriculum that are already in place and integrate that health education. So the next slide is just resources, and then I have my references. And I wanted to then turn it to you all and see if you had any pearls of wisdom to share about your experience with health literacy or health education, or any questions that you have.
And again, if anyone is timid, they can always throw their questions in the chat and I can read them off to Dr. Goodwin. But many thanks for that great presentation. And yeah, feel free to unmute or drop your question in the chat.
I'm curious for those of you joining that are part of a school, do most of your schools have any health literacy type education or health education similar to what we talked about? I see a no, but I wish. And yeah, and several strategies are used in special education classrooms, and that's a really good point. And certainly maybe individuals would benefit in all classrooms, it sounds like too.
Emily,
oh, go ahead.
What struck me with your first activity, which was so useful, is, often, I have trouble just seeing the food label with my general eyesight issues. So it just reminded me of literacy. Just, I think this is fantastic, but it just was a reminder to me, like, just even, there's health literacy, but just even kind of the more basic nuts and bolts may be challenging too.
Definitely. Yeah. Literacy and reading is really foundational, and so important.
Yeah, and one of the cases that I discussed at the immigrant health session is I've had numerous patients that can't actually read numbers. And so how to do dosing, how to navigate therapies without having familiarity with alphanumeric Roman numerals is a challenge. Arabic numerals is a challenge. So Dr. Goodwin, did you chance to read the comments in the chat by Crystal Alley and Mindy Kitterman?
Yeah, so Crystal, it sounds like you're saying that your knowledge has come from release of information so you can communicate with the doctors and healthcare team and from parents, and sometimes even going to doctor's appointments with students whose parents are English speakers or of other languages. Yeah, I think that the communication piece is so important, and being able to have parents and educators and healthcare teams kind of connect. That release of information can be so key to help facilitate that communication, especially if there are barriers. And let's see, in the behavioral health field, there needs to be some education. Psychotropic prescriptions often predispose children to obesity and prediabetes. Yeah, definitely. There's a lot of metabolic side effects of different medicines that are used. And then in general, medicine, to just giving and taking medicines requires a certain degree of health literacy as well. I don't know, Mindy, and feel free to unmute if you had other specific questions related to maybe how those people get education, or if there was a specific question you had.
I think also just to chime in on Christina's comment about spending lots of time with families to find resources like SNAP and WIC, and wondering if health literacy programs could improve access to resources. I do think health literacy impacts our ability to navigate systems and to navigate websites and resources to just try to figure out what resources are available to help us. And so I think that does play a large role in how families are able to independently navigate these complex systems to get services and support.
I
Yeah,
think it
and
also, oh, go ahead.
Okay. The comment that I would make, I think that there's a running theme that communication is a challenge, and understanding the vocabularies that we use in educational space and the behavioral space and the medical space is different. And so hopefully programs like this, as we all get together and kind of work through cases, work through different topics, hopefully become more familiar with each other and are able to better share vocabularies and experiences.
Yeah, I agree. And I think it also really speaks to that organizational health literacy. I really loved that update in the Healthy People 2030 definition. And on the resource slide, there's lots of really great links on the CDC website and places where you can kind of check health literacy of information you're putting out there. And it's really made me give a lot of thought to what I put in my written discharge instructions and using Teach Back when I'm going over something new, and recognizing that sometimes it's going to take some time, but it's also part of my responsibility to be, clearly communicating and identifying best ways to do that.
Agreed. And I think along those lines, and circling back to Crystal's comments about, having to do a lot of work independently to understand health concerns, I think, right, school providers, behavioral health providers, people who are not trained in the medical field, there is a lot that you don't learn in your formal schooling or your formal educational programs, and opportunities like these where we can connect and communicate hopefully can help bridge some of those gaps with medical knowledge and the knowledge that you all bring as school and behavioral health and other providers and social work providers.
Great. I want to make sure we have enough time for case, and I want to encourage any of you, if you have any cases that you're thinking about, please don't be shy to reach out. We'd love to have you present a case at one of our echo sessions.